Okay. I'm just going to start here. This is a dog with a incidentally found splenic mass on the tail of the spleen. Otherwise, the dog is doing well. So we're going to do a full explore. And AFAS just showed the lesion. We haven't done a full abdominal ultrasound. 3V chest rays showed no evidence of lung mets, which is obviously very good. So we did discuss with the owner, who's also a referring vet, whether we should do abdominal imaging beforehand to see whether there's any intra-abdominal mets, such as abdominal ultrasound or CT scan, or just go into surgery and do a explore. And that's what the owner decided to do. So first up, we're going to do an abdominal exploration and then see whether or not there's any evidence of metastatic disease and whether that's resectable or not if there is. My hope, obviously, with an incidentally detected mass is that this is just going to be a benign mass and no evidence of mets. Yay, not much swearing. Okay, so I've gone through a bit deeply here. Continue down here. This is subcutaneous fat. Don't want to dissect too far laterally. That increases the risk of dead space and incisional complications. Okay. I'm just going to connect this up with the ventral midline, lifting it up. There's a push cut here. That bleeding is coming from the vessel, not the abdomen. Let's control that with the scalpel. We're not plugged in for this. You can just plug us in for the harmonic scalpel, please. Just plug us in for the harmonic scalpel. Okay, we're just testing the harmonic scalpel here. We're all ready. So to improve our visualization, we're going to remove the falciform ligament. I do this routinely in all cases. I'm just getting used to using this harmonic scalpel. There's a small segment between the blade and the actual end here that doesn't cut, and so I'm just getting used to giving the right amount of tissue in the actual cutting part of the blade. So the main difference between the harmonic scalpel and the ligature is that the harmonic scalpel cuts by producing heat up to 200 degrees of heat compared to the ligature, which does it through an electric current, which means the harmonic scalpel doesn't interfere with the ECG or anything like that. But it also, because of that degree of heat, produces a lot of lateral thermal damage, so we don't want to use this close to any important structures. such as intestines, aorta, or that kind of thing, just in case it might cause unintentional trilateral damage to those organs. Sorry about my cough there, just getting over a cold. Certainly more effective in getting through fat than the ligature, which often insulates against the electric current. So we do have an adhesion of this mass of the falciform to the mass on the tail of the spleen. We're just going to resect this adhesion up here. We don't peel off these adhesions just in case they do represent neoplastic invasion into the adhered structure. Okay, so that's come off. There's the adhesion there that's attached to the mass that we've now removed. As you can see, the falciform ligament is usually quite large. We've done it on the, removed most of the attachment on the left side. Now we're going to do it on the right side. It's continuing through here. It smells very much like a barbecue right now in here. I'm just going to come across to the base of the falciform ligament here. So this is on this attachment to the xiphoid cartilage. We're just removing it from. And almost done. So that falciform is now discarded. That's the falciform there. We're just going to discard that. And now we've got... So once we're at this stage, I'm going to remove any gauze swabs from the field because they're easily lost if there's any blood in that. I'm going to just put the alpha retractors in there. There are some lesions on the liver there, a bit hard to say what they are. Let's see if I can get a closer view there for you. Can you get someone in to focus in? You can just focus the, not focus, zoom in with the camera. Sure. I'm going to be moving it actually, so just zoom in. Yeah. That's good. That's good there. So as you can see here, there's multiple lesions here, 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 here. So we'll take biopsies of those, but they're white coloured, not red coloured, so it's a bit difficult to actually say definitively whether they're benign or not, but we'll take samples of that. And so here's the splenic mass here. It's a bit multilobulated, which is a bit of a concern. So you can see actually here, kind of come out just a little bit. So there's the mass on the tail of the spleen. No evidence of rupture, although the adhesions may indicate previous rupture, and the adhesions of the omentum onto that are indicative of plugging those leaks. So we're just going to come across now. Let's see if we can focus a little bit closer on here. And just remove this spleen. We're going to use the harmonic scalpel with the hilar vessels here. Just focus this out a little bit more for you. So we're just going to come along the hilus. And cauterize and transect all of these smaller vessels. Because of the size of this dog, we're also going to individually ligate the splenic artery and vein. I'm just going to progressively make our way along the hilus here. There are still adhesions onto the splenic mass, which we need to transect off with this. With the harmonic scalpel. A little bleeder there, so we're just going to grab that. That may be the splenic artery there, so we're just going to plug that up and grab that, control that. There's a nice bleeder for you. So the table's set out so we can control that very quickly. The harmonic scalpel can cauterize vessels as large as 7 millimeters, which may be the size of the splenic vein and artery in a dog of this size, but I wouldn't trust it entirely, so we are going to go back and ligate those vessels. And almost there, we're getting to the short gastrics now, as they attach onto the head of the spleen. That's all the hilar vessels done. Now we just need to get these mental adhesions off. And the little lesions like this are always a bit of a concern. You can see this here. Whether they're a splenosis lesion, which is just a ectopic spleen tissue, or whether they actually represent metastatic spread to the omentum, mental seeding through a previous rupture. It's hard to tell. We're going to remove that and submit that for biopsy. Okay, so let's just work off the rest of these adhesions from the mass, or to the mass. So again, these are all the adhesions. There are some, let's just refocus this. So this is our spleen here, this is the mass here, and there are these mental adhesions onto the mass. There are little lesions like here that may represent just a blood clot, splenosis lesion, or metastasis. We're going to come far enough away from the splenic mass itself that just in case there's any cancerous infiltration into this omentum. We're just going to transect this with the harmonic scalpel. Excuse me. It's progressively moving through this omentum to transect it away from the mass. So if this were to be a splenic hemangiosarcoma, then there's no evidence of rupture, so it's not stage 2 disease. The big question is whether it's stage 3 disease or not, which will be determined by the biopsy results from the liver. If they're negative for metastasis, then the dog's got stage 1 disease, which is just an isolated, non-ruptured, non-metastatic splenic hemangiosarcoma. And their prognosis tends to be better than dogs with either stage 2 or stage 3 disease, but the chemotherapy is still recommended. So this is the removed spleen with the mass, as you can see there. We're just going to remove that from the surgical field and then take some, ligate the femoral artery and vein and then take a biopsy. Can I have some 2O PDS, please? Thanks very much. Now we're just going to identify that splenic artery and vein. We know it's in here somewhere. And you can feel it by palpating the artery, which is just here, and the veins within that. You can actually see the splenic vein here. I'm just going to dissect that out. Oops. So here's our splenic artery right here. Let's get a little bit closer down there. So this is the splenic veins in the tips of my DeBakey forceps, and this is the splenic artery pulsating right here. We're just going to ligate both of those. Let's see if I can separate those out to ligate them individually. This is our splenic artery here. Okay, so there's one. In large breed dogs like this, I'm going to usually do a transfixion ligature on the artery as well, just in case it slips. Now, both of these vessels are less than 7 millimeters by the looks of them, so you could theoretically just use the harmonic scalpel, but I don't. We're here, so we may as well just minimise the risk of post-operative bleeding through failure of the seal from the harmonic scalpel by supplementing the vascular control with these ligatures. That's the transfixion ligature on the splenic artery. And now we're just going to put a single ligature on the splenic vein. Isolate that splenic vein now. There's our splenic vein. Okay, so it's the splenic vein done. Let's get the stitch material out. I'm just going to come across here and just supplement this with the Harmonic scalpel. Still got a bleeder up here as well, which we'll control. And we still got something going on in here, so it's always important to check this. Where you can find where the bleed is coming from. Seems to be in there, so just going to come across the base of that with the Harmonic scalpel. That seems to have controlled that bleeding. Okay, so that looks good. So I'm just going to do a quick explore of the rest of the abdomen here. So let me just go out a little bit more widely. Can you get someone to straighten it up for me? We're just going to straighten up this view, but here is the liver's cranial here. I'm going to straighten up the... no, too far. The left, a bit more. Yeah, a little bit up. Yeah, that's it. And I'll just move that there. Great, thanks. So we're just going to grab the stomach here. Feel the stomach, no lesions we can feel in there. Move down to the pylorus. It's a blood clot. From the pylorus, we're going to grab the duodenum. You can see the pancreas here, no lesions in the pancreas, which is good. I'm going to put the rest of the intestines into this mesoduodenum and create what's called a duodenal basket. So we're going to use that, reflect that, have a look at the kidneys. No evidence of problem there. The right adrenal gland is often not that easy to see. It's in this fat way down here. I can feel, though, that it's normal size. I don't feel any masses on that. And again, no other evidence of problems. There's more lesions on the liver there. Move through the intestines here, just looking for any masses. This is the duodenal flexure here, attached to the mesocolon. So sometimes it can be difficult to get around this corner. I'm just going to grab that jejunum, proximal jejunum as it moves from here, around that duodenal flexure. Let's get that blood clot off as well. Okay, then we're going to run the rest of the bowel here, looking for any masses. This is the jejunum here. Nothing that we can see there, which is good news. Now moving into this ileum here, as you can see by the mesenteric or antimesenteric vessel, moving into the ileocecal valve and cecum area, and then to the ascending, transverse, and descending colon. Again, nothing there. Then we're going to use that mesocolon, reflect that laterally to be able to visualize the left kidney, as well as the left adrenal gland there. Again, no evidence of any problems I can see. So the only thing of concern is the liver lesions. So we're going to take some biopsies of those. That looks like actually a pretty good section there. You can see that you've got one largish one there, smaller one there, and it's a free part of the intestine. So we're just going to use the harmonic scalpel to come across to biopsy these lesions. Just twist this around a little bit so I can go around the curvature of the quadrate liver lobe and avoid traumatizing the gallbladder unnecessarily. Okay, so that's that removed. You can see the lesions. Oops, sorry. Trying to get the camera right there. You can see the lesions. There's one there. There's one here. So you've got that for a biopsy, as well as the spleen and the the omentum. I'm attempt to take off some of the right medial lobe as well, just to get more of a biopsy sample, just to maximise the chance of getting a definitive diagnosis. I'll just reposition there so we get a bit of vision of this. Watch the harmonic scalpel do its thing. Okay, so we've got another liver lobe here, the distal end of the right medial liver lobe, with all of those lesions in there. It's a bit hard to see with that reflection, but there's multiple white lesions in there, so we'll submit that as well. I'm going to inspect those partial liver lobectomy sites. I don't expect to see any bleeding, none from there, and none from there, which is good. So we're all finished now. excuse the cough. Can I grab some 0 PDS, 20 PDS, and 30 monochrome? So now we're just going to close up and see if we can get a pretty good view there. Oops, I think I've touched the other one. Okay, take this alpha out. Thank you, Sabrina. Okay, for the closures, we always start distally or caudally for the linear elbow. Major reason for that is that when you're finishing up the linear elbow and you're putting in your blind sutures where you can't really see, you've got all of this space here between the linear elbow and the body wall down to the liver and the gallbladder and the intestines. So you're much less likely to accidentally entrap an intra-abdominal structure with your linear elbow closure because of that increased space in that region. Excuse my cough there. I want to take good bites of the abdominal wall to minimize the risk of any wound breakdown here because of inadequate bites and suture pull through. Get that away. One thing we'll quickly do is count our lap sponges to make sure we haven't left any behind. We've got 1, 2, 3, 4, 5. So yep, all lap sponges are counted for. So we're going to have this dog on an ECG overnight to monitor for any ventricular arrhythmias, which are relatively common in dogs following a splenectomy. Most of them don't cause any cardiovascular compromise, but if they are there, we do monitor for other parameters like blood pressure, etc. to see whether they are compromised or not. If they are, then we'll treat with at least a bolus of lidocaine and maybe a CRI of lidocaine if we don't convert him out of the arrhythmia. But that's pretty rare to need to do that. There's still a reason to keep them in overnight following an electrosplenectomy like this. You can see here, I've got this much space, at least up to my knuckle, between the abdominal organs and the linear elbow. So when I'm putting these blind sutures in, I'm far less likely to grab one of those intra-abdominal organs with my needle pass. I don't think I'm going to have enough room to actually tie this knot. So can I grab another 0 PDS, please? There you go. Okay, so that's the inner elbow layer done. Now we're just going to close the subcute and subcute. Subcute and then intradermal, I should say. I've only got one light going right now because I've contaminated the handle of the other one. So I've got a bit of a burnout here. Apologise for that. Excuse me. Mm-hmm. Yeah, I'll do that once we're... I am, yeah. Good anonymity. Good anonymity. Here comes Jen, my technician. So we've got splenic mass, 2 large liver biopsies, and a mental lesion to submit.
Where's the?
It's the mental one. And then we've got 1 and 2 liver, and obviously the spleen.
And the liver go together?
They can all go together. Well, that can go separate. Okay. Those can go together.
Okay, so 3 separate containers for everything.
If you want, they can. I'm sure you won't get that into a jar, but they can go in together as well if you want.
With the liver and the spleen?
Yeah.
For post-op, ECG monitoring, you want a Q1 for a certain amount of time, and then...
No, as in, it's probably easier for ICU to have it on continuously.
Well, I just meant like for the first 12 hours, and then if there's no abnormalities, okay? Or you just the whole time?
Yeah, the whole time until tomorrow morning.
Okay. And then, did you check the masses?
Not yet. Okay. Sabrina and I have already discussed that. We'll do it once we finish this up. Can you also ask them to check for, is there any histologic evidence of invasion of the tumour into the omentum or mesentery? I'll tag that with some suture material.
Invasion.
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 Into the adhered omentum and mesentery, or omentum and falciform ligament.
Sorry, what's the last word?
Falciform ligament.
And I assume you're good for her to have her thyroid check while she's in hospital?
Yes.
And you're doing intradermal?
I am trying to do intradermal. The start's the easy part, it's the end.
How much is that?
Okay, so almost finished here. I'm just going to try and bury this knot. Which I think I've been able to do. Okay, so we're all finished here. Can someone stop the recording?
Stop recording.
Yeah.
Go ahead and stop streaming.
Yeah.